welcome to meeting number 42 of the House of Commons Standing Committee on Human Resources, Skills and Social Development and the Status of Persons with Disabilities. Today's meeting is taking place in a hybrid format pursuant to the House Order of January 25th, 2021. The proceedings will be made available via the House of Commons website. The webcast will always show the person speaking rather than the entirety of the committee. Pursuant to Standing Order 108 Sub 2 and the motion adopted by the committee on Tuesday, February 2nd, 2021, the committee will resume its study of the impact of COVID-19 on seniors. I'd like to welcome our witnesses to begin our discussion with 5 minutes of opening remarks, followed by questions. Nous avons parmi nous aujourd'hui.
We have with us today the Quebec Association for the Defending the Rights of Retirees and the Semi-Retired People. We have Serge Séguin.
And from the Manitoba Association of Seniors Centres, Connie Newman, Executive Director of the Age Friendly Manitoba Initiative. For the benefit of our witnesses, I'd like to offer the following additional comments. Interpretation in this video conference is available. You have the choice at the bottom of your screen of either floor, English, or French. Les services
You have interpretation services for this video conference. At the bottom of your screen, you can choose either the floor, English, or French. When you speak, please speak slowly and clearly. And when you're not speaking, your mic should be on mute. We will start with Mr. Séguin for 5 minutes. Mr. Séguin, welcome to the committee. The floor is yours. Thank you very much. The Quebec Association for Defending the Rights of the Retirees and Semi-Retirees, the AQDR, was founded on May 1st, 1979, and we have 41 chapters in 16 administrative regions of Quebec. We have 25,000 members, and that is, again, in 41 chapters in 16 administrative regions of Quebec. The committee's work today on the impact of COVID-19 responds to a survey that we have done at the end of 2020 on the impact of COVID-19 on our members. We undertook a survey from the 30th of November, from the 30th of October, rather, to into November 2020, and that was done with 17,000 members, and we had 1,214 respondents who worked to answer those questions, 91 closed questions and open questions, and there were comments that were made in the open questions. And we have, it was certified this as 97% representatives. So from the responses that we got from this survey, we came up with an analysis and a report that allowed us to make 15 demands with the government of Quebec and 36 recommendations to the government of Quebec, to the Ministry of Health and Social Services, as well as to the minister responsible for seniors and caregivers. From the responses we have and our recommendations, we have made 4 theme groups. The first theme is maintaining quality of life and health and social services during the pandemic. And that corresponds to the theme of the quality of life component. We also have a second theme, maintaining quality of life and health and social services during the pandemic, health and social services component. The third theme was the improvements in health and social services. Theme 4 was support and recognition of caregivers. All of the documents of this survey can be found on our website, and you have been provided with the address of our site. And so you will be able to access the documents from our survey. And up until today, we have met with the three people responsible in the opposition at the National Assembly in Quebec. We have met with the minister responsible for seniors and caregivers with the results of our survey, and we have asked for a meeting with Mr. Christian Dubé, Minister of Health, and as of yet we have not had an answer. But the Minister for Health and Social Services has received our report and the report of the survey that was done. So our work is related to what you're doing and what we've asked the government. You'll find them in the recommendations, and this is what we've done to define the needs and the services for the elders for the next year, and also we in the case of other pandemics that might occur. So thank you very much. That is my presentation. Thank you very much, Mr. Séguin.
Next, we're going to hear from the Manitoba Association of Senior Centres. Ms. Newman, welcome to the committee. You have the floor for 5 minutes.
Thank you. Thank you for the experience. This is very interesting. I'm Connie Newman, Executive Director, as you're aware, Manitoba Association of Senior Centres Age-Friendly Manitoba Initiative. I work with a team of 6 older consultants as we connect with 60 plus member centers throughout the province and 90 plus age-friendly communities throughout Manitoba. Today, I am a caregiver for 3 people whose home is a personal care home, 3 different homes, 3 different businesses. I'm fortunate. My 3 special friends, they're not family, all survived COVID. I have experience. I'm also one of many my age who are tech savvy, sort of. I'm going to share with you a collection of thoughts, my own and others, I connect with on a regular basis. Personal care homes are institutions. They are supposed to be homes. Why do they present as hospitals and or institutions? Collectively, we must improve regulations provincially as well as nationally. Regulations must be monitored. Funding transfers to the province must have standards attached. For families with loved ones in personal care homes, challenges were heightened when in-person visits became impossible due to COVID-19 restrictions. There was, in some cases, almost total isolation from one another, periods with no visits, visits with shorter, less frequent, and with encumbered conversation and connections. Caregivers, volunteers pre-COVID provided much needed support to their loved ones, family, and friends. COVID hit, and that support was left to staff that did not have the time to focus on the person that caregivers and volunteers did. Now to community. 93% of older adults are living in community, often known as aging in place. I became involved in age-friendly concept early in my career. It takes an entire community to raise a child. I believe it takes an entire community to look after its own older adults. 2008, the World Health Organization told us to get ready for the change in population. It is 2021 today. We have more older adults than we have teenagers. There's a population shift. Many are living longer than ever. Many of us healthy and trying to maintain our health. Many older adults do not have family in their community. The community is a social connection. We all know that social participation is determined of one's own health, no matter what age. COVID hit, and we were not ready for the population shift, and we sure were not ready for isolation. I'm an age-friendly champion. In many daily connections, I am constantly involved with the domains of age-friendly, social participation, communication, housing, transportation, community health, building outdoor spaces, civic participation. When I think about them, and in a community in Canada where there is an age-friendly focus, COVID was there. The community was working together for each other of all ages. When looking back at these domains, underlying COVID impacted seniors with transportation or total lack of it. Programs for those aging in community, that's 93% of us, must be maintained, enhanced, and encouraged. In Manitoba, we have support coordinators by community and district that are tasked with connecting individually to older adults and assisting where they can in connecting them to services. During COVID, they did their best in attempting to maintain some sort of connection. Zoom connections saved many where good Wi-Fi existed. 211 by phone became a lifesaver. People with dementia and their caregivers are among the most valuable in our communities, and the COVID-19 pandemic has put those families at even greater risk. Persons with dementia and caregivers were negatively impacted by the gap and left by suspension of formal programs. We have adult day programs that stopped running. Lower income seniors living on their own or in congregate settings are in need to, we need to ensure that they are meeting basic needs, Maslow's hierarchy for those seniors. Internet access, who's responsible to ensure equal access to the World Wide Web? Is it fair if a person lives in rural or remote that they do not have the same quality of access to information? Why is it that low-income housing in an urban setting does not have Wi-Fi access today? Devices are cheap. Training is a minimal cost. Wi-Fi for equal access must be an all government focus. We must continue to collaborate with the World Health Organization, the Decade of Healthy Aging paper. Since COVID hit, I have spent several mornings listening to those wise ones from all over the world. We must learn from each other. We know COVID has impacted older women living in rural and remote, and the data today is impacted or underreported. Many more are suffering mental health issues, more significant anxiety and depression from prolonged isolation. We're seeing now today lots of hesitancy to get back and involved. The opportunity for social connection engagement is limited going virtual. Many older adults have limited Wi-Fi access or may choose not to use it.
Ms. Newman, if I could get you to wrap it up there, please. There'll be lots of time to expand on your remarks during question and answer.
Thank you. Sorry.
Okay.
COVID, seniors, elder abuse. 8.2% of older adults are experiencing abuse. Justice at all levels of government must pay attention to existing laws, education, and the meaning of those laws. We need to watch for ageism. We as a civil society, along with government setting policy, must work together to ensure no one is left behind, no matter what age. The failures of COVID must be lessons learned moving forward. Thank you.
Thank you, Ms. Newman. We're going to begin now with rounds of questions, starting with Ms. Falk, please, for 6 minutes.
Thanks, Chair. Before I start my time, I'm just wondering if you can confirm that the total of seniors meetings, that today counts as half of a meeting versus a full meeting?
Confirmed.
Thank you. And I'd like to thank all the witnesses for both of the witnesses for coming here today and contributing to this study and for your advocacy on behalf of older Canadians. Thank you for that. As we gain a fulsome understanding of the impact of the pandemic on seniors, your testimony will help paint a clear picture on how we can better support seniors. And Ms. Newman, I would have to agree with you. I am a member of parliament from a rural riding, and I believe that access to internet is imperative. We need that, especially when everybody's locked in their homes and kids are doing school and seniors can only FaceTime or Zoom with others. So I absolutely agree with you. And we have heard about the importance of choice and autonomy in helping seniors age and live with dignity. And Ms. Newman, could you share with this committee what role, if any, did age-friendly communities play in supporting seniors throughout the pandemic?
Definitely. I know in the smaller rural communities in Manitoba, the support coordinators, along with others in the community, connected with each other. And in large urban centers like Winnipeg, those same senior support coordinators were able to make the connections and be visible by phone or online with those that were isolated. And it's the network aspect of age-friendly communities. Who's talking to who?
For sure, that completely makes sense. Are there lessons to be learned from the pandemic on how to better create age-friendly communities to combat pandemic consequences like social isolation?
The short answer is yes.
Mm-hmm.
One of the principles of age-friendly is communication, and what communication exists between all the stakeholders in a community, in a town, in a village, in a city.
Mm-hmm.
And that there to me to us is one of the critical pieces. Who are the stakeholders? Who's working with who, so that we're all looking for the best for all?
Mm-hmm. Could you suggest what role the federal government could play in supporting age-friendly communities, or how the federal government could assist in that?
I'm a member of the Age-Friendly Public Health Agency of Canada Age-Friendly Reference Group, and we're talking about that cross Canada on a monthly basis, and we've got different ideas. They have become the Canada-wide place to go for information and lessons learned. We can all learn from each other. I get on those meetings once a month, and I hear about good things in BC, Quebec, a few others, PEI, New Brunswick, and we need to share with each other. So federal government, in my mind, right here, right now, needs to look after that aspect of the Public Health Agency of Canada Age-Friendly Reference Group.
And I think what's so great about that too is that you're connecting with people from across the country, where even though regionally it may be different, there may be similarities or items or things that you can glean from that then can be implemented where you are, which I think is great. I'm just wondering if you could touch on how services offered by senior centers changed, or how the needs of seniors changed during the pandemic.
Depending upon the income level is the first one. We all got shut down across this country. Those seniors, and the data shows it, who are tech savvy, senior centers, many of them went to Zoom programming 2-3 times a day. I've got a senior center in Manitoba, had 75 people doing exercise on Zoom on a weekly basis. Daily basis within the week, 6 programs a week. So there was that flip to, if you've got good Wi-Fi access, to Zoom programming in a lot of cases. Mm-hmm. We did a lot of promotion around 211, which gave older adults both phone, gave information. Communication is huge. all the time. The pandemic made it even more. Low-income seniors don't have Wi-Fi access. They can't afford it in many cases.
Mm-hmm.
And they're living in community. To me, one of the biggest hits, and we've got to remember that, there are 93% of older adults living in community and aging in place. They're connecting to centers if they've got the money for the device and Wi-Fi.
And access to internet. Yeah. Mr. Sagan, quickly, in your organization's study on the impact of COVID, did it reveal commonalities among your membership on how the pandemic impacted their mental health and well-being?
Réponse courte.
Can you make a short answer, please? Mr. Sagan, we don't hear you. I'm wondering if it's just me. No, I was on mute, sorry. So briefly, if you could answer. Well, the problem was really the isolation that people felt isolated from caregivers and families. That had a huge impact both in long-term facilities as well as people aging at home here in Quebec.
Thank you, Ms. Falk.
Thank you.
Next, we're going to go to Ms. Young, please, for 6 minutes.
Thank you very much, Mr. Chair, and thank you very much to our witnesses today. Lots of good information. Ms. Newman, I wanted to go back to you, and you had just started near the end of your presentation to talk about ageism. And we know that it's a long-standing issue that we've had to deal with. I wanted to know, if, in your opinion, what are the best ways to counter ageism and promote age-friendly communities?
That's a tough one, because ageism starts with me, in part because, and we're all aging, but sometimes we forget that. And I think there has to be a concerted effort by those of us that are older to don't use and I get caught, the idea that, well, I've got gray hair, I'm getting old, and the bones are getting rickety. It also starts with businesses who are promoting frail. Not all seniors are frail. So I look at that, and we have policies around ageism, both at all three levels of government. And just because I'm 73, why should I be treated different than a 40-year-old? And I think that's one of the places that governments need to look, because we hear during COVID that some doctors in ICU units were very concerned about having to make the decision around who gets the ventilator, a 40-year-old or an 80-year-old. That is terrible to put anybody in that position. I'll stop there.
No, that's a very good point, and it's tragic when those decisions are made. The fact that you have maybe considered, if I can say that, intergenerational initiatives, is that something that you think is a real key here? What we need to see more of?
Absolutely. When I think about age-friendly communities, there's no age on that. It's birth to the end of life. And if a community of, say, 800 are connected through intergenerational activities, through community events, we can do that by district. We can do that by districts within its city. And that's one of the principles that we're pushing in Manitoba as we move forward, is getting community stakeholders to connect with each other and to see about community events, bringing everybody together. Some of our First Nations are very good at that. And it's we have age silos in policy and government, in the school system. And that doesn't help when we get hit with a pandemic. It counteracts age friendliness.
I did want to ask you, you mentioned at the beginning that you cared for 3 COVID survivors. So I take it that the 3 of them had COVID. No? One had COVID.
One had COVID.
And what did you learn from that experience that would help us as we go forward, as far as how seniors with COVID are treated?
For me, it goes back to communication. And I'm a communicator. And I'm a communicator with all 3 of those housing places, homes. And the moment I got the call that she had tested positive, the communication became paramount to us to ensure her quality of life. And I can't stress that enough. When I look at, I've been fortunate. I'm tech savvy and I'm on Zoom meetings every day, sometimes twice a day. With personal care homes, we need to find a way, one, to ensure they have Wi-Fi access. I'm starting to nag now. But if a personal care home has Wi-Fi access, that is part of a solution. It's not the paramount one. One of my friends in a personal care home, we had to end up buying for him a special Shaw internet cable access for his room to ensure he could read the Globe and Mail and the New York Times online. So when we think about that and his quality of life, I mean, he's stuck in there and health got him there. And I think of other people in there, and he's fortunate he's got family. We need to all remember as decision makers, there are many, many older adults that don't have family living in their community. And that's why I have got 3 of them, and they're not family, they're friends.
And a good friend you are. And thank you so much. Mr. Chair, do I have any more time?
You don't have enough for a question and an answer, but
Okay.
if you want to make a
No,
closing observation, there might be time for that.
Well, I just want to thank both of the witnesses, and the fact that you're working so closely with seniors. I really thank you for what you're doing and what you're able to tell us to help us with this report. Thank you again.
Thank you, Ms. Young. Madame Chabot pour 6 minutes, s'il vous plaît.
Madame Chabot, 6 minutes. Thank you, Mr. Chair, and welcome to our witnesses. Thank you for your testimony. My question is for Mr. Séguin. We know your association, and I know you're present in all areas of Quebec, all regions. In my area, in the Laurentians, and so you spoke about your survey in 2020 and your recommendations, and you know that there are public inquiries that have been requested in Quebec, but I was wondering with respect to the other recommendations, I see that you're talking about poverty, increasing poverty among elders. And there's a question of increasing from 75 for the old age security, and that starting in 2022. And people don't see any people are very upset. They don't see any reason to discriminate on the basis of age. So do you have any recommendations or any comments on that? Yes, the answer. When we spoke with the minister responsible for seniors and caregivers, we spoke about that question, and we asked why it was only as of 75 years that there would be an increase. And so what about people who that are 65, and we were told that maybe that they were better equipped and that they were in better financial condition, which is really false. In Quebec, we have statistics that show that 60% of those that are over 65 have an income that's less than $30,000. So to think that people at the age of 65 have a lot more money than people who are 75, well, this is really a false perception. At least in Quebec, that is the case. Question. Well, I must say that I also tried to get data that would justify this, and I'm just saying that what we've seen in Quebec with the results that we were told yesterday, we received in writing that 59% of 75 years and older, whereas 52% only for those that are over 65 years, and so that would justify that they have to wait till 75, and there's such discrimination. Answer. These are statistics for Quebec, but there's 52% of workers who don't have any kind of pension or money set aside for their retirement. And so some people may have RRSPs or other types of funds for their retirement, but 52%, that's really high of a number. It's not everybody that's working for the state, whether it's a provincial or whether it's for a school board where you can get good retirement, where you have a pension. It's not everyone that has a pension waiting for them. So I think on my board, we and my administrators are saying that we can't think only of people who have a pension from their employer or from the state. You have to think about people who don't have a pension. And that's 52% of the labor force. Thank you. Question. You know that Quebec, the National Assembly, has been asking for an increase of 35% for their health. And in Quebec, we don't, and we need additional funds to be able to have the necessary resources for the elderly. Do you have a position on that? Answer. For us, our position is that we feel that it's not necessarily regarding the federal government, but we feel that the provincial monies have to really go to services for those over the Liberal period, and where there was a reorganization of all of the services, and there were modifications to home care, and so it was not you weren't able to you would be able to help a second person if you went into someone's home. If there was one elder you were caring for, you could give services to another's. But if now you have to make a separate request, so we're wondering why pay 3 or 4 people to give services, different services, when you could potentially give a service. One person could give services to more than one elder in a home. Question. There's a question of staying at home. This was discussed in the committee a lot for the elders, especially with COVID, that it was being imposed even more, that people needed to remain in their home. With respect to what's happening in English Canada, there's a lot of much more money that's in English Canada. So there are a lot of more people in Quebec that have less money who are in long-term care. And we're thinking for some years now we are privatizing the aid for people at home, and we now also have these private long-term care, and we've been dropping the amount of funding for home care, and people do want to stay in their homes. Of course, people maybe that they're in their 60s, they don't have their kids now, they're gone, and they maybe are married, or they have their own homes, or they're far away. And then mom and dad are home in a huge home, and they decide to sell their home, and so they want to go into some kind of home, seniors residence, and we've seen people that were with it during the COVID. They weren't able to go out. They need to be able to go out and get some air. A lot of people have decided to return to their own home because they don't have any kind of autonomy when they're in some kind of a long-term care home. So I think that we're seeing in Quebec people are starting to feel that when there's a new promoter, that somebody that is building homes for elder people, when if they're starting to do discrimination when they're doing publicity, well, we feel that, well, this is not so interesting for people to be renting. Thank you, Mr. Seguin. Mr.
Thank you so much, Chair. And my first question is for fellow Manitoban, Connie Newman. Thank you so much for your testimony so far, and it's so nice to have you in committee today. My first question relates to public ownership. I'm wondering if you feel that Wi-Fi should be a publicly owned utility, something that's deemed as essential for everyone, like water, for example, as a public utility. I ask that because you spoke a lot about Wi-Fi and the fact that many seniors don't have access to Wi-Fi. And it's actually, I wanted to mention Article 27 of the UN Universal Declaration on Human Rights that states that, in quotes, everyone has a right freely to participate in the cultural life of the community, to enjoy arts, and to share in scientific advancement and its benefits. And one of my concerns I've had in Winnipeg Centre for many seniors is that they've been very isolated as a result of, not having access, even if they do have skills in how to use computers and iPhones, because they can't afford internet. Do you feel that it should be a public utility?
I think that might be a loaded question.
It is a bit of a loaded question. I'm not going to lie.
I personally, I believe it should. We're in the new age. We can't be doing things that we did 30 years ago and have policies and rules from 30 years ago. We need to get with the times, and the times and COVID showed us that internet access is a utility. And should it be common out there? Yes. Now, would some of my political friends of all stripes agree with me? Probably not. That's where the loaded comes in. But you have, and to my friend, my witness friend from Quebec, a lot of what he was saying is so very true in Manitoba too. Income, people who had reasonable income through COVID may survive through it all. But those that did not, and housing was an issue, transportation's an issue. The day I have to think twice about whether I'm paying for the pills that some doctor has prescribed for me, paying for internet, those kinds of things, there's a real problem. And it's a societal problem and it's a political problem. And you can put me on a soapbox doing this.
Okay, well, I'm going to keep you on your soapbox because I agree with what you're saying. One of the things that I've been pushing for is a guaranteed livable basic income. And one of the, because we have income guarantees, for example, OAS is an income guarantee. I'm arguing it's not livable for the very reasons you're talking about. So I'm pushing for a guaranteed livable basic income for all, including for seniors, in addition to current and future government programs and supports. For example, if the pharmacare bill our party actually put forward passed, it would be in addition to having full medical or full coverage for medicine. Do you think a guaranteed livable basic income would make a difference for seniors and lifting them out of poverty?
when we look at, and it's not only seniors, when we look at the homelessness that's happening today because of COVID, and we look at the number of older adults that are homeless because of COVID, guaranteed income of some sort should help to negate that.
Yes, I agree. And I think, going beyond just guaranteed income, we need to make sure that it's livable and accounts for regional differences as well. So getting back to income, so in the 2021 budget implementation bill, the government has proposed providing a one-time payment of $500 in August 2021 to OAS for those 75 years of age or older, and increasing OAS for individuals, or 75 years of age or older, and increasing OAS for individuals 75 age and over by 10% as of July 2022. My particular concern relates to women, many women who don't have pensions because they work their whole life as, for example, caregivers. Many women who are, for example, living in poverty as they age. Do you have, for both of you, do you have an idea as to why the government has excluded seniors 65 to 74 from an increase to OAS? Maybe I can put that question to you, Mr. Sequan, or Sequan, is it Sequan?
Oui, c'est bien
Oui.
ça.
Yes, that is how you pronounce my name, yes. Yes, a short answer, Mr. Sequan. We would like to know why. The only that was done, the only thing we were told was that people who were 65 and above, they were richer than people that were 75 and older. That's about it.
And next we're going to go to Mr. Tucker, please, for 5 minutes.
Thank you very much, and thank you for our witnesses. Just a little bit, because we were talking about the unfairness of some of the decisions about 75 or making it the cutoff lower or not having a cutoff for seniors, which I would agree with, because it has been unfair. At the start of the pandemic, we knew that seniors were going to be the unfortunate target of this virus, and we should have, I think after we turn the corner in the years to come, we'll look back and we'll look at some of the decisions we made, and it's not about pointing fingers, but we should have bubble wrapped our seniors. The seniors were the ones that were going to be affected the most by this virus, and I don't think we have done enough for seniors. Ms. Newman, you remind me of my mom a lot, and I appreciate your testimony so much, and your demeanor and straight shooterness of it. I very much appreciate it. I'm from Saskatoon. I've spent time in Winnipeg a fair bit, and Prairie Boy as well, and some of the struggles we have out here is probably very similar to Manitoba. And could you expand a little bit about your awareness of the differences of care during this pandemic in rural Manitoba versus in Winnipeg, but which I believe you live in?
There is a big difference. And access to care, urban Winnipeg, Regina, Saskatoon versus rural, the difference is night and day. And that's why I'm a real proponent of our support coordinators that are all over this province. We have more than 103 of them in various communities throughout the province. And they're the go-to, they're the person who has a group of seniors, or because they're in rural Manitoba, everybody knows everybody else. And so they knew to go and check on Mrs. Smith, Mr. Jones, etc. And the biggest thing is when we went into shutdown, and then home has a set of rules. And there are many people in rural and remote who have no family and were left in destitute situations because nobody knew, one, or two, they were so afraid because they weren't all that healthy to begin with. And how do they get to testing? How do they get to their vaccines? If it wasn't for our support coordinators out there, I'm not sure that we would be where we're at today with vaccinations. There's still a problem there, and I need to deal with it after I finish with this. But it goes back to communication, and who knows what out there. To me, is a big one.
And you touched on vaccines, and that's the next thing you're turning to. And I think it's been well documented the delayed, second dose is prolonging the restrictions out there. Have you had hear any stories from Manitoba on the deliveries of vaccines? We all get it that it's delayed getting into Canada, but are there any creative programs that is running right now in Manitoba to get seniors vaccinated in rural or urban areas that you can share with the committee?
Short answer is no. I don't know that there's any creative, because what I hear is when people get into trouble and they will phone me and they will say, Connie, what do I do about Mrs. Smith's living, and how does she get to a vaccine site? So because I communicate and because I connect, I know which button to push to solve that problem. And we all, including everybody on this line, need to understand that as we age, we become more isolated because our friends pass away, we're disconnected, family's not there, and we don't know who to call. And I mean, one of my friends I referred to, her son is in New Zealand. So every now and then I get the phone call because his mother's in a personal care home. And so when you go to rural Manitoba, the need for community connection, in my mind, is huge. And we know if small town Manitoba is having a fair, everybody's there. Everybody knows each other. That same thing happens across Canada. And we haven't done fairs and events. And my favorite, even in Winnipeg, are to go to rural Manitoba. Where are all the trucks? And all the trucks will be by the coffee shop. And that's where communication happens. And that set of trucks takes care of everybody. And that is sadly missing. And we don't have, here we go again, Wi-Fi to connect those people when they can't connect themselves.
Yeah, and just briefly, I'll wrap up, Sharon. I know I'm running out of time. As a conservative, I do support the equal access to the internet, and you'd be find an ally in me as an MP for that. And the Blue Bombers are only going to be Grey Cup champs for a few more months. Enjoy that.
You think?
Yeah.
Thank you, Mr. Tucker. And next, Mr. Dong, please, for 5 minutes.
Thank you very much, Chair. I want to thank both panelists for spending time with us this afternoon and offer us great insights on your perspective of the challenges that lies in front of us right now. First of all, I absolutely agree with you that access to internet is essential. We've seen how our senior population utilize that technology to stay connected with the world, with the outside, with the community, with their loved ones. You know, I have a bit of story to share myself. Both my parents are turning 75, and my mom, you know, has always afraid, you know, the advancement of technology. She's always, you know, she's like a minimum list, and she never had any interest in digital technology. But I've seen the evolution in her, and she's now using different apps, and much of it, other than, you know, out of necessity, is also influenced by her friends.
Yep.
She's a very active member of a local community center, and they do morning exercise, and every day before the pandemic hits, they find ways to connect. And so access to internet is absolutely essential. I agree with you. The other thing I want to share is in my riding, as I represent the Toronto riding, North York. although it's in Toronto, but it's a very sort of settled, mature community. You have various senior groups coming together, support each other, and I've seen a lot of inspiring, leadership coming out of the challenge, facing the challenges. And I can say I personally helped 3 groups in their application, give them some guidance and information about the New Horizon program, which has seen a huge increase during the pandemic. And they took advantage of it, and they brought those classes, just like you said, online, keep everyone, the recreational activities high. To both panelists, what's your experience, what have you heard with communities using the New Horizon program during the pandemic?
Who's going first?
We'll go with Monsieur Sigan, and he's been there quiet for some time.
Yes, thank you, Mr. Dong. Well, I can't. No, there's a call for projects, but we haven't seen any call for projects. But as soon as there is from the federal for elder, a lot of Quebec organizations, even ourselves, we have put in applications federally for different for development of different activities for the elderly. And in Quebec during the pandemic, I don't know about elsewhere, but in other provinces. But we were at stay-at-home order, under stay-at-home orders, and we were working from home, so we weren't able to see each other. But our sections have always been active through phone calls with the elderly or through video conference also. But the main problem, as Madame Newman was saying, and this is the case for all over Canada, where the elderly don't necessarily have access to internet. So in urban areas, we don't have that problem. But as soon as you're in a rural area, either you've got low-speed internet, and so you might as well not have it at all, really. And companies, whether it's Bell or other service providers, that they don't want to develop it in rural areas because they say it's not profitable and it costs too much. Thank you, Mr. Séguin.
Ms. Newman's feedback on the New Horizon program.
Keep them coming is the short answer.
I love that.
I'm privy to I'm part of a team on an older Winnipeggers social engagement project, 5 years New Horizons. It's been excellent in bringing 5 organizations together to collaborate and work together for low-income seniors in Winnipeg. We also received in this last call money for our age-friendly resource team and how to mobilize communities on communication. So I would say keep them coming. My big thing is you want older adults to fill them in and to be part of. And it's a good thing I'm an older adult and I can fill them in on behalf of our team.
Right.
For some groups, they don't have that expertise and it's a difficult application to fill out.
Thank you, Ms. Newman and Mr. Dong. Suite Madame Chabot pour 2 minutes et demie.
Madame Chabot, 2.5 minutes. Thank you. I'm going to be quick. I'm going to have a quick question. And I'd like to give both of you the chance to respond. With the study that's underway on the elderly, I think that we know that the elderly people have been affected and during the pandemic, and we're trying to see as parliamentarians what programs could improve the situation, what type of solutions would really make a difference for the elderly. So if you have any suggestions. Mr. Séguin, well, I think that what would be very useful would be that the federal government, whatever the political party, that they understand that people that are 65 also have financial problems as much as people 75 and older. And so I don't see why there would be any discrimination of the elderly. Thank you. Madame Newman, I have understood, yes, in 2021 in Quebec as well as across Canada, sometimes it's not only in rural areas. Sometimes in urban areas you can have internet connection issues. Madame Newman, what would you suggest that could be done? Solutions.
3 levels of government need to work together to get the internet Wi-Fi aspect across this country solved. I saw this. Does that mean I stop?
That means you have a minute.
Oh, I haven't. Oh, so
Keep going. You're good.
To me, from a Government of Canada point of view, human rights, equal aspect, equal access to information is paramount. All 3 levels of government have a variety of programs looking after a variety of ages. But if we don't know about them, how do we access them? And to me, that's huge.
Thank you, Ms. Newman. Merci, Madame Chabot. Next, Ms. Gazan, please, for 2.5 minutes.
Thank you so much, Chair. And I agree with Madame Newman. The New Horizons for Seniors programs certainly was of benefit to my riding. Talking again about something that isn't of benefit, however, not to be negative, but I was asking you, Monsieur Séquin, about the pension. And my question was, and I know that you didn't have enough time to answer, what are your thoughts? Like, do you have any ideas why the government has excluded seniors 65 to 74 from the increase in OAS? I have concerns because we know that many seniors live in poverty in this country. It's no different from 65 to 74 and 74 and older.
Madame.
Go ahead. Thank you.
Madame Gazan, we are also worried, just as worried as you are. We would have liked to have seen a reason, a valid reason, from the representatives of the minister. And so we really have a lot of questions. We're wondering, because people that are 65 and over, I don't know why we would create a separate category. If we consider the statistics that I gave you earlier, that people, that 60% of people that are 65 and older have less than $30,000 in income per year. So we have 2 economists that are retired economists that are working on all of this, and they established that in Quebec, how much does it take for an elderly person to live? And in Montreal, it takes $28,000 for somebody, a senior. So do you think that somebody can really live in Montreal? The maximum they get would be $18,000. So they're already underneath the threshold, the poverty threshold, by $10,000 for living in Montreal.
Gazan?
Thank you so much, Chair.
Do you want to offer a couple of comments on that, Ms. Newman? Go ahead.
I think we all need to remember, and in support of Serge over there, when we start to open up, you need to look at who's working during the day at the low income jobs. Tim Hortons, Walmart, some of the big box type stores. And a lot of those are those people that have to work because they're not getting enough dollars through pension, or they don't have a retirement pension plan. We see that in Manitoba. I'm sure it's the same thing existing in Montreal, Quebec. So look around. It doesn't take much to figure out And they've been hit the hardest because all of those jobs disappeared when we went into shutdown.
Thank you, Ms. Newman. Mr. Viss, please, for 5 minutes.
Mr. Chair, I was under the impression that after 1 hour we were going to move to clause by clause.
Well,
Can take the time, Mr. Chair.
Sorry?
I can use the time if you don't want to use it.
Okay. Mr. Viss, we have the full 2 hours, so I was going to finish out the second round. It appears that the Liberals are keen to ask another round of questions, so I'll cede the floor to you or one of your colleagues for 5 minutes.
I'll pass on my time. Thank you.
Okay. Anyone else on the Conservative side have questions for the panel? Oh, Ms. Gazan, you're with the NDP.
I know,
Rosemary's hands up.
but I'm just saying if nobody else wants it, I would gladly ask many questions yeah.
Okay, Ms. Falk, I see your hand up. Go ahead.
And Chair, is that for 5 minutes?
Yes, go ahead.
Okay, wonderful. Thank you very much. I would like to follow up, Mr. Sagan. You had a very short amount of time to respond to my question, which was in regards to your membership and the impact, the pandemic, how the pandemic has impacted their mental health and well-being. And I'm just wondering if you have anything further to add to that.
C'est sûr que, Madame Falk, la pandémie.
It's clear that the pandemic in Quebec was very, very hard on seniors. We've suffered a lot, but with the stay-at-home orders and being isolated, without social connections, without being able to see friends and family. So in Quebec, this probably is the same elsewhere in Canada, where people were crying on either side of the window, trying to speak, and the elder person on the other side of on the inside wasn't able to understand them, and so it was very, very difficult. Even those that were doing well mentally, some suffered, and some have even decided that they would never go through that again, and they were deciding to move. And so this has been very difficult. So it's been 42 years that we have been in place, our association, but it was in the 60s and 70s that the long-term care homes were started up in Quebec, and that the services are always having problems. There's lack of staff, lack of people to help the elderly. So it's been going on for a long time. And we were hoping that the government had heard us, but you would think that it really took the pandemic, and then all of a sudden the media started saying, well, this is awful what's happening. And yet, as an organization for the last 42 years, we have been in existence, and we've been aware of these difficulties for a long time, and nobody listened to us. And now, because of the pandemic, all of a sudden it seems like it's all new, and that we need to help the elderly. But I think it's about time that something was done. So I think that things could be worse than what we're seeing today in the pandemic if we get more pandemics. Does that answer your question?
I think you bring up a good point too. Like even those seniors that may have Alzheimer's or dementia, even just that transition when everything went into lockdown, that mid-March 2020, not knowing what's going on, not being able to see those that are familiar, routines being changed, not only is detrimental to the physical health of the individual, but also to their mental and emotional health, which I think is so important to recognize well through all of this. I'm just wondering too, did the needs or priorities of your membership change during the pandemic?
Yes. The survey that showed that people are really asking for more services within their residences. They want to have more autonomy. They want to be able to have services that are up to their expectations. They want to be listened to, and they don't want to be treated as children. And we feel that often they're in the long-term care homes. We hear complaints as to that they feel as though they feel like they're in prison. That we heard that in the news not long ago, where there were two people, two seniors that weren't allowed to go outside of their residence because there was an outbreak. And so those two people were not allowed to go out. And even they called the Sûreté du Québec to stop them. There had to be calls to the Ministry of Health and Social Services. They had to intervene so that these people would be able to go and be with families during the time of the outbreak.
Yeah, and I think too, it's just so important to recognize autonomy. And just because you're aging and getting older doesn't mean that you want to give your autonomy away. And I think it's so important when it comes to aging in place that we recognize it's not just where you live. It's shoveling the snow, it's food preparation, it's house cleaning. There's so many other aspects to making sure that Canadians can age in place safely and healthy.
Thank you, Ms.
Et je vous dirais, si le président.
And if the chair would allow me to say what Madame Newman was saying, people that are living in rural conditions, often they lose their autonomy much more quickly because they don't have their families near them. They're alone in their home or maybe in a long-term care service. They don't have access to internet. And so really they're just left to themselves. And in Quebec, if we were able to look at the statistics after the pandemic, we'll see before the long-term care homes, 50% of people in long-term care homes weren't visited by their families or close people. And it was only 25% that had visits once in a while. Maybe it was Easter, Mother's Day, Father's Day, that type of thing. So people, when they don't have a family near them, they really do risk losing their autonomy much more quickly. Thank you, Mr. Séguin.
But we're well past time for this round, and but we do have one more person to pose questions, so hopefully you'll be able to get your point across. Le dernier parlementaire à poser des questions, c'est...
The last person will be Mr. Lauzon for 5 minutes. Mr. Lauzon.
For their remarks and to be here today. Je vais commencer avec...
I'm going to start with Mr. Séguin. There's good news. You know that our two prime ministers, the Prime Minister of Quebec as well as the Prime Minister of Canada, came together to announce that in Quebec everybody will be able to have access to internet and high-speed internet and affordable internet. Did you hear that news, and did you share that information with your members? And in September 2022, including in rural areas, everybody will be connected. I'm sorry, Mr. Lauzon, we didn't get that news, but even if we had heard, there have been so many promises, and sometimes we really wonder what the reality is going to be. I don't want to be sarcastic, but it's not a question of that. But really, in everyday reality, when you look at social housing, we were promised not so long ago that Quebec province were promising 15,000 new social homes, and we still haven't had them. But well, it would be great if it did happen. The internet access, it really will help people who are elderly and living in the rural areas. And in Quebec, this will really help them to stay in contact with their families. Question. Well, thank you. That's great. I will continue because I would have a lot to say, but I just wanted to remind you that you are a very important organization. We have been able to meet. I was around the table with the minister when we did meet, and we know that during the pandemic you had several challenges, but during the pandemic we gave seniors we gave them $1,500 per elder. So we discussed that. So did people that you are represented, was that a help to them? Well, answer. Well, we didn't ask them that in our survey. We're doing an analysis. We did do a survey in the spring amongst our members, and there are numbers that need to be analyzed. But I do know that right now, everything that is with respect to pension for 75 and over, that it will be increased. We get a lot of people that are calling us, people that are between 65 and 75, that are really concerned, and they really feel like they've been set aside by the federal government. Question, I understand, but when you say that the only answer that you heard when you were around the table, that you heard that people that were 60 at the age 65, they had more financial wealth. But did you know that following our study that they had more from 70 years, statistics say that 75, they in greater need of health care, and 57% of them were women, and that there were more than half, almost half, that were widows once at 75. So those are statistics that the minister shared during that meeting. So you also said that you thought that was good to get the 10% increase for 75 and above, but you think that should be extended. But do you remember this being shared with you by the minister? Answer, well, I don't remember all of the exchange, but I do remember that for Quebec, we're not really, it doesn't correspond to those numbers. You may have data, but it doesn't necessarily apply to our perception of the situation. So yes, it's great for people 75 and over. We won't ask you to take away any increases for them, but what we'd like to come back to the idea that you really shouldn't have dropped the people that were between 65 and 75, because that sets aside a totally separate category, and we feel that people that are 65 and older, really, they should have had a portion of what you offered to those 75 and older. Question, I know that time is moving very quickly here, but the seniors were at the center of the program that your organization supported. I was wondering if you noted that within the Quebec community, there are supports. Those supports are the most used during the pandemic. Did you have any trouble to ensure that the services would be easily accessible to all elders? How did your organizations, the organizations you're aware of, how did they ensure that adapted services become available? Answer, well, the social health and social services were very difficult, offered with great difficulty, because it was very hard to get a doctor's appointment, and so for people that had to have any kind of surgery, those were set aside. And so for the elderly people, if they had to have a hip replacement, or if they had other joint problems, their knees, for example, if those surgeries were all set aside. And so all of these delays for operations will have an impact on the health of people. One last question. No, you don't have time. Sorry. That's all the time we have right now. Thank you very much, Mr. Séguin and Madame Newman. We appreciate very much your testimony and your being here with us today, and the work that you do in each of your provinces, in your communities, and in the communities where you're working.
We very much appreciate you being here. Thanks for being so generous with your time and advice, and for the excellent work that you're doing in your communities. It will be of great assistance to us in our work. We are now going to suspend, colleagues, because we have a couple of people to join us for the clause-by-clause examination. So to both of our witnesses, you're welcome to stay, but you're free to leave. And thank you so much for being with us today. The committee stands suspended.
Merci beaucoup.
back to order. Pursuant to the order of reference of Wednesday, May 26, 2021, the committee will resume its consideration of Bill C-265, an act to amend the Employment Insurance Act, illness, injury, or quarantine. Before we begin clause by clause consideration, I would like to welcome Benoit Cadieux, Special Benefits, Employment Insurance Policy, Skills and Employment Branch from the Department of Employment and Social Development, who is available as a resource to us to answer any policy-related questions in the context of the bill. And I'm also pleased that we have with us Philippe Mela, Legislative Clerk, for any legislative, technical, legal matters that may arise. So, with that, we will proceed with clause by clause. Colleagues, please use the raise hand function to be recognized. Pursuant to Standing Order 75 sub 1, consideration of the short title and the preamble are postponed until the end. I therefore call clause 2. Ms. Dancho.
Thank you, Mr. Chair. And a couple of quick things. I wanted to thank the Bloc Québécois for bringing this bill forward. I think it signifies a real step forward in our EI benefits for those who really need them. I did want to make a comment that I know myself and my Conservative colleagues on this committee and in caucus at large have been working quite hard internally to put forward a policy that was resoundingly adopted at our recent policy convention to extend sickness benefits to 52 weeks. We're from the perspective that in Canada, having a full year to have sickness benefits, whether you're dealing with a significant illness or a horrific injury that you need rehabilitation for, really sends a very clear message of our special benefits in this country, and I think would mean a lot to all Canadians who really need that time. And something about a full year, I think, is quite important and something that we can really hang our hats on and say that we've accomplished as lawmakers. So for that reason, I'd like to move that Bill C-265 in Clause 2 be amended by replacing line 2 on page 2 with the following. Quote, time is 52, end quote. So the full amended clause would read, quote, because of a prescribed illness, injury, or quarantine is 52. So, Mr. Chair, that's my amendment.
Thank you, Ms. Dancho. Clause 2 of Bill C-265 seeks to amend paragraph 12 sub 3C of the Employment Insurance Act to increase from 15 to 50 the maximum number of weeks for which benefits may be paid because of illness, injury, or quarantine. The amendment attempts to extend the benefits to 52 weeks. As House of Commons Procedure and Practice, 3rd edition, states at page 772, since an amendment may not infringe upon the financial initiative of the Crown, it is inadmissible if it imposes a charge on the public treasury or if it extends the objects or purposes or relaxes the conditions and qualifications specified in the royal recommendation. In the opinion of the chair, the amendment proposes an extended period of benefits which impose a charge on the public treasury. Therefore, I rule the amendment inadmissible. Madame Chabot.
Mr. Chair, Madame Dancho has presented an amendment. You gave your opinion. I had raised my hand before that, and so I don't want to be looking at the amendments right now. That was my opinion. But with respect to the bill, as it stands, I would like to note that the bill that we have before us, and with this request for Clause 2, and this is really corresponds to a motion that was adopted in February last. And I would like to thank all of the parties and the opposition parties for having brought it to 50 weeks. So this is the wording that we've used in all of the work that we've done, that is the 50 weeks, which the fact that that's why we have it here before us. And this is a study that also followed the budget director's notes on the question that for the 50 weeks. And so I think that the 50 weeks, you'll remember the study within the committee with on employment insurance, there was a consensus, and we thought it was important to increase the benefits. So I do acknowledge all of the work that was done by the Conservative Party to bring forward a proposal. I think even at there's 52 weeks. I think that does show the goodwill that the Conservatives bring forward for workers that are ill. And that's the idea of this bill, is that the 15 weeks isn't enough, the 26 weeks is not enough for people that are not well. So we do hope that 50 weeks will be able to be adopted, and that corresponds to what we've been proposing from the beginning. And I think the committee, I think we have studied this bill, and it is based on the 50 weeks, and I would above and beyond any questions of whether or not it was admissible, I think that we should stay at 50 weeks. So I would like to invite my colleagues around the table to consider that we should keep the 50 weeks. And I think that corresponds to the testimony that we heard on Tuesday, and other testimony to the fact that 50 weeks is really what we need. Thank you, Mr. Chair. Thank you, Madame Chabot.
Thank you, Chair. And I just wanted to echo my support for this amendment. You know, and certainly what Madame Chabot indicated as well. I think we've had lots of testimony. It's you know, I know that you're the chair and you've made a ruling, but it's just unfortunate that we weren't able to address this further in the committee.
Mr. Vaughan, please.
It listened with great interest as people dissected arbitrary numbers. I'm just curious if just so I understand why one advocacy position is 50 and the other is 52, what the additional 2 weeks is metriced on beyond just the symmetry to the calendar. And also, I'd be curious to understand the cost implications between the two, if Ms. Dancho would have that estimate.
Ms. Dancho.
Thank you, Chair, and I appreciate the remarks from Madame Chabot and the support from Madame Gazan. I'm glad to see that we can work together across partisan lines, across a common good. And Mr. Vaughan, I think you have really great questions. I would just say, you know, I think Madame Chabot's or the block bill is very good at 50 weeks, but from our perspective, the work that we've been doing internally with our party has just been 52. And I think that one sort of a year rounding out is just a really nice symbolic gesture for those who really need this support. And that's the motivation behind our amendment. But since the chair has ruled it inadmissible, I do understand his ruling, and we won't be challenging the chair on this, but we do wish that we could have made it 52 weeks. But again, we'll thank the bloc for their work on this.
Did you model the cost differential? I'm just curious.
I'm not sure what the cost would be compared to 50 weeks. I just would assume that it would be a little bit more. But I think from the testimony that I've heard and the consultations that we've done with our party, and particularly in Quebec, that a year really sends a strong signal that we support people who really need the recovery time, and we stand by that 52 weeks. And Mr. Chair, I'm not sure if we're supposed to be Are we allowed to debate an amendment that's not admissible?
Just curious.
I'm just wondering.
No,
I don't want to waste any time, but if it's not admissible, it's not admissible. So.
Fair enough.
I appreciate that, Ms. Doncho, and I appreciate your remarks. And the advice that you're giving me is the same as what I'm getting from the clerk by text. So if there are any other interventions with respect to clause 2, we'll hear them now. And if there aren't, I'm going to ask whether clause 2 will carry. Any further interventions with respect to clause 2? Seeing none, shall clause 2 carry? I see consensus, so clause 2 is carried. That brings us to clause 3. Mr. Vaughn.
I failed to withdraw my hand. My apology.
Okay. Is there any discussion with respect to clause number 3? Seeing none, shall clause 3 carry? I believe we have consensus. Clause 3 is carried. Shall clause 4 carry? Carried. Next, the preamble. Shall the preamble carry? I see consensus. Thank you. The preamble is carried. Shall the short title carry? That's carried. Shall the title carry? And that's carried. Shall the bill carry? It's carried. Shall the chair report the bill to the House? Yep. Carried. Shall the committee order a reprint? I'm not sure that a reprint is necessary given that we've made no amendments. Am I right on that, Madam Clerk?
That's right. This is the legislative clerk, and you're right.
Mr. Clerk. Okay, so no need for a reprint. Okay.
No need.
Okay,
Sure.
Madame Chabot, s'il vous plaît.
I would like to mention, colleagues, that I would like to thank you. Thank you for all of this work. We didn't do it for ourselves. We went above and beyond our partisanship, and we did it for all of the workers in Canada, for people that need care. And I think that this bill will be very important for things as we go ahead. So I would really like to thank everyone for this process that has allowed us to move ahead. And I wasn't able to say it last time. Also, thank you for the report on the study on employment insurance, which was done with great rigor, with the great help of our chair. I'm very pleased that it's being presented today in the House, so thank you for having let us know. And so I wanted to thank you, colleagues. This was really an excellent collaboration. So once again, thank you. Thank you, Madame Sancho. The next time we'll increase it by 2 weeks. Thank you, Madame Chabot, and congratulations.
Ms. Doncho?
Oh, I didn't hear you, Chair. Sorry. Thank you, Madame Chabot, for those kind words. And I just wanted to echo what you said. It was great to see some collaboration today. I just did want to conclude with one question to our Liberal colleagues, if they're aware if their government will be providing a royal recommendation so that this can become law. I think that would be great to know and a great way to end today's work.
All right. I don't know if anyone knows enough to respond to that at this stage. Are there any further interventions, any other business to come before the meeting?
Mr. Chair, I would just ask that perhaps the Liberal members can get back to us next week if we do meet about the royal recommendation, and that so Madame Chabot and the rest of us can know if this could have a chance to survive and be made into law.
Well, you can ask that, but I'm not sure that the royal recommendation is the prerogative of the people in this group. So you can consider the question asked.
You have no idea how much more I want to know what Cabinet's up to.
Right. Madame Chabot, s'il vous plaît.
Non, mais vous êtes bien.
Well, you're well placed to do PR. So we're count on you, colleagues, from so that we'll get. I think it's a great question. I know that in committee we can't bring forward any motions to recommend royal assent, but yes, I think that it was mentioned. And so my question was to know, Mr. Chair, can we hope that this will be in the House shortly? Would you be able to let us know? I would be ready to table it Monday. So if the bill is in good shape for that, that will be the next time I'll be in the House. That's great. Thank you.
All right. Is there any further business to come before the meeting? Is it the pleasure of the committee to adjourn the meeting? Excellent. Thank you very much, colleagues. Thank you, Mr. Cadieux and Mr. Mella, for your presence. I guess I'm grateful that we didn't have to work you any harder, but we certainly appreciate you being here. Okay. Have an excellent weekend, everyone. We'll see you back here on Tuesday.
Safe travels, Leo.
We're adjourned.